Today is 12th of October 2021, and for today I was on a long day shift again. This is my third long day shift in a row. Um, so when we arrived, or when I started the shift, um, we were short of one HCA. The nurses were complete, and it was very good, and I was very thankful for that. Um, one HCA was still sick, so we only had one HCA on the floor. Thankfully, we had two students as well, which I had rostered on their first day, so at least we have two students per day. So I was thinking that everything would be okay because we have a complete number of nurses. We've got two student nurses and one healthcare assistant. And thankfully, when our matron checked, and actually the other HCA, the one HCA that was present, is actually supernumerary, or on a period where she needs to observe. She's just new, and she needs to learn the basics and learn how the ward works. So thankfully, our matron pulled one healthcare assistant from the other ward to come to us. So thank you for that, matron. Um, so we were all in good spirits and say we are complete, it's gonna be fine. Then 15 minutes after handover, suddenly this group of five people in dark blue scrub suits comes in from the bed company, and instantly I'm like, I remember that actually the other day, or no, it was back in Friday, they did send a letter and told us that they would be performing a bed audit. So basically, they wanted all the patients who could sit down on the chair to get off the bed, and we all had to strip all the beds, and so that they could check the bed condition, and if there's any mattresses that are um, not really in good condition, or they need to condemn the mattress and take it away and just dispose of it and give us a new one. So the information since Friday wasn't really handed down properly. So we were caught in a surprise because suddenly they were all here, and they were like, "Okay, we're here to do the bed audit." I'm like, "Oh yeah." um, the patients are were still in the bed, so I'm like, "Hi, my name is Jacob. I'm the nurse in charge. Is it possible to give us 15 minutes so that we can um, get the patients to their chair and strip the beds? Because we've literally just finished handing over, and we're now starting our medication. So we're in the middle of doing that, but I'll ask the healthcare assistants and students, and I will facilitate um, the patients to go to the chair." So we did all of that, and it was suddenly a rush of a lot of people. Once we had all the patients in their chairs, and then all this bed audit personnel from the company came in 15 minutes later. And then, if that wasn't enough, there's like a lot of people in the ward. Suddenly, we have this news that actually there are no beds everywhere that is available to accommodate patients who are in A&E, or emergency department. And we have this sort of rule in A&E that if you are if a decision has been made for you to be admitted to the ward, then you must have a bed within 12 hours of that decision. And that is what the goal of the bed managers is, when they try to find beds for people from emergency department. And there were 10 patients that are about to breach, and there wasn't any bed available. And because of the COVID restrictions, we could not send a patient straight upstairs from ED without a negative COVID result. So they all have to come to our ward. So we all have to transfer the patients we currently have who already have a negative COVID swab and send them upstairs. So, in a flash, one of the seniors of the nursing hierarchy came to the ward and said, "Oh, Jacob, I need to get this patient to this ward and we need to do it now. There are 10 people waiting in A&E." So, just like that, um, the patient went upstairs, and then another nursing head comes in and said, "Oh, there's another patient that needs to go upstairs, blah blah blah." And there was like a lot of movement for the whole day. No, not for the whole day, for the whole morning. And around midday, we had actually moved, I think around 6 or 7 people either transferred, um, discharged early, and there was um, a patient I think who was self-discharging as well. So just before midday, we had a lot of movements already. And like, if you if we were just doing movements and not doing medications or not doing um, washing or doing the changing the beds and doing observations, then it would be very easy, very quick, and we're like, yeah, fine, let's transfer this patient, that's it. But if you're in the middle of medications and you're trying to finish that and your mind is focused on that, and then suddenly, oh, you need to get this patient now, or if you're doing observations, which of course is priority, so you get your baseline data and see how your patient is at the start of a shift, and suddenly you're like, hey, this patient needs to go upstairs, like now, can you do it now, like now. So you suddenly the pressure is on you, like, no, I still want to finish this, but you have to do it, you have no choice because there's no more beds. So that amount of pressure can really be a lot sometimes. So that's how it is in the medical assessment unit. Okay, now after lunchtime, it sort of calmed down a little bit, and we were all um, thanking that all the movements were done. We all had a uh, deep breath of relief. But then, so this is what happened to me now. So, because two of my staff wanted to have a first break, so usually I have first break for the reasons that I need to eat on time. Otherwise, I have this gastric reflux, and also when I go hypo, it also can trigger my migraines. But for this occasion today, they wanted to go first break the staff, so I'm like, okay, that's fine. I'm gonna accommodate that you want to go first break for today, so that's fine. 'Cause I didn't really think anything would happen, so okay, that's fine. But basically, in the afternoon, I had my lunch break at past 3 p.m. already. So when I went for lunch, um, my stomach was really growling and was starting to get painful, and I'm like, oh, I'm really hungry now, so I should eat. When I sat down to eat something, the pain got worse. Like it was like what I could feel like it was being crumpled from inside, and I was like, oh no, I'm like, this is really painful. So what I did was, um, I have this prescription for omeprazole, um, because I'm taking naproxen for my knee um, pain and knee injury before. So I took omeprazole, and I was using up the time for my break to just sit down and relax. And actually, I tried to go to sleep for have a nap for like 15 minutes, but then in the middle of my nap, I was suddenly awakened by this severe pain in my upper abdomen. And so I said, oh no, I think this is still acid. So I took some antacid medication, which is, sorry, there's something in my eye. I took this antacid medication, and then went back to work. So when I was back in the station, it flared up again, and it was so painful, like pain score 10 out of 10. And one of my colleagues said, oh, why don't you have a Gaviscon? Because that really helps, reduce the acid as well, or neutralizes the acid. So I had 10 mils of Gaviscon as per the recommendation, and I gave it like 10-15 minutes, and I was trying to concentrate and do some referrals on the computer for the patient, and I couldn't. It did not help. I couldn't take it anymore. It was still so painful. I'm like, I can't barely read what I'm looking at, and I'm in so much pain. So I decided, like, you know what? Nothing has worked. I've tried what I can in terms of medication. I've also drunk loads of water to see if it can help neutralize if it's actually acid, but nothing's working. So I had to go to A&E, and it was around, let's say, 4 o'clock, I think. And yeah, I had to wait in A&E. It wasn't too long actually, because the queue wasn't um, a lot, because they've already accommodated the patients in the morning. And thankfully, after I was triaged, I was given a bed in majors, A&E majors, and then and a doctor saw me. So I had my bloods taken. I still got my look. So basically, the nurse tried to cannulate here. So there's a mark there now. Um, she failed for some reason, because I know that when the patient is a healthcare worker or a staff nurse, it can be a bit nerve wracking. So I did not, when she was doing the cannula, I did not look at what she was doing. I just turned to one side and like say, yeah, that's fine, just do it. But for some reason, she failed at once. So she said, you don't really need the cannula for now. So she took a blood sample from here. Look, it's not that's still fresh. From here. So she managed to take a blood sample from that, and then later on the doctor came in, and after all the assessment, he came to the conclusion that it is most likely severe gastritis, and that with a query if there is any ulcer or any bleed. So he wanted to prescribe the IV pantoprazole. So the nurse tried to, no, not the nurse. The nurse was busy. So this doctor who saw me actually worked a lot of times in our ward, and we sort of become very comfortable with each other, and almost like friends. I'm so I was seen by him, like it was a very light, not very light, but it was a comfortable assessment by the doctor. And because he wasn't busy after seeing me, and the minors was busy, so he himself did a cannula. um he did do it twice. This is the first one, I think. The vein was a bit small, so he had to find another one, which was here. I even teased him, like, there's four veins there right on my metacarpal, just pick one. And it's like, Jacob, you are the patient today. I am the doctor, so I will choose which vein I will use for your cannula. I'm like, yeah, yeah, okay, that's fine, that's fine. And so he went for this one here, which is in the cephalic um, vein. So anyway, to make this story short, I had a chest X-ray just to rule out because he was thinking that the sudden like severe 10 out of 10 pain that happened might might be a sign of some sort of perforation and air coming, and that could be seen through an X-ray with air near the diaphragm. That's what he told me. Um, so I had an X-ray, and then there was no abnormality with that. They took my bloods as well, which thankfully the HB was not low, and the urea, which apparently increases when you have a bleed before you can see a drop in the HB. It was normal as well. So that's why at the in the end, he said um, it's severe gastritis, and then when he assessed me as well, he saw that I was quite dry. I mean that means when they say dry, that means I'm dehydrated or lacking fluids. So they gave me one bag of Hartmann's, or in the Philippines it is equivalent to lactated ringer solution. So um, 1 liter of Hartmann's, and then they did an ECG as well just to see if there's anything um, wrong in terms of cardiac wise, because it can sometimes be abdo pain can sometimes be referred pain for cardiac problems. And so yeah, so that was done. It was actually very, it was done very well and done very quickly. So thank you. I'm not gonna say the name because I want to keep the confidentiality, but you know who you are. Thank you so much for for seeing me and assessing me and treating me very well in A&E. Um, so when I knew that I wasn't gonna be going back to the ward soon, I called one of my nurses, the most senior one left in the ward, and I found out actually that while I was away and waiting in A&E, they had to transfer a total of additional 10 patients up, and we're about to receive another 10 patients. So I was feeling so sorry and so bad because that is a lot of pressure and that is a lot of things to do. And later on, I was informed that actually it went fine because the matron sort of organized where some nurses from the other ward came to transfer some of the patients. So the movement was one after the other, but um, some of the nurses helped out with the transfers. So it wasn't just one nurse doing all the transfers. So yeah, so thankfully that was well organized by our matron again. And so I just wanted to say thank you for to my nurses who were there earlier. You work so hard, and I know it's not an easy job, and I am sorry that um, I had to leave a little bit earlier than I should have because I really have this super severe pain that I wouldn't have been of any help anyway if I was just there in the station. So at least I got treated, and I now have to take some medications for the next 2 weeks. But at least I will be there for the following shift. So yeah, I think this has gone on for a bit longer than I expected. So that is what happened today. I actually went home later than if I was in the ward. So if I was just working and nothing happened, I would have went home at 8 o'clock or just after 8. But instead, I went after 8:30 from A&E. But yeah, which is it's good that everything was assessed and treated. So I'm I'm pleased with that, and of course thankful that NHS is still free. So let's keep it that way, guys. So, and that is what happened today. Day 3, long day on Tuesday, and that's it.